All right, everybody. Thank you so much, everybody, for attending and for your time and attention now, or if you're listening to this later. Today, we are going to be discussing and sharing ideas for mobilizing healthcare resources with better data and forms. We'll be discussing what we've seen, share some best practices, and then also share a specific use case with a specific mutual client. I am Paul Lazatin, Head of Partnerships here at FormAssembly, and I'm joined by Crystal Saturn, and I'll go ahead and hand it off to Crystal so she can introduce herself.
Thanks, Paul. Hi, everyone. My name is Crystal Saturn, and I am a principal consultant with Solem. I am based in Sacramento, California, and in the Salesforce practice for the East Bay market of Solem. Happy to be here today with Paul to share one of our technology solutions to help make data better for one of our clients.
Excellent. Okay, we'll go ahead and let's go ahead and get started. All right. So let's start with who we are. FormAssembly is the leading enterprise data collection platform dedicated to helping organizations streamline processes and navigate even their most strict standards for any data security and privacy needs they have. We have over 5,000 customers, 3,000 or more of which are also Salesforce customers. We are both GDPR and CCPA compliant, and our compliance cloud plan is both HIPAA compliant as well as PCI DSS Level 1 certified. And what we do is we make it easy for people like you to create forms, collect data, and then send that data to a wide range of popular systems. Go ahead and transition to Crystal to give you a little bit of information about Solem.
Awesome. Thanks, Paul. And so Solem is a modern consulting firm focused on strategy, technology, and business transformation. Our headquarters are in Seattle, but we have offices across the United States and in a few other countries as well. Our key technology capabilities and partnerships are with Amazon Web Services, Google Cloud, Microsoft, Tableau, and Salesforce, which is a capability I'm a part of and is where our use case study for today is going to be focused on.
Yeah, I love it. Excellent outfit. We always love working with and recommending Solem. So go ahead and move on. Turn my camera off. Okay, perfect. Okay, so first, what we're going to do is explore some top use cases for healthcare. FormAssembly can simplify many processes for healthcare organizations, including, but definitely not limited to, these use cases that you're seeing here on the screen. We have helped healthcare organizations with patient intake forms, streamlining any appointment sign-up processes that they might have, supplementing any healthcare research initiatives they might have by collecting data for those healthcare research initiatives. And very recently, given light of the situation, we've also helped a lot of organizations with any COVID-19 related projects and initiatives they have, so we can all together help them as much as we can combat the COVID-19 pandemic. And then lastly, a lot of use cases that we've seen recently are different ways to collect data in order to improve and streamline supply chain management operations for our clients. Okay. So the net of what I'm trying to communicate here and the goal is to easily, safely, securely, and seamlessly collect this data and then send this data to where it's going to be most actionable and effective. So now that we've looked at some top use cases, let's dig into some common pain points that we've heard across healthcare organizations. So what we've heard from clients in this space is that they wish they had more options for addressing any inefficiencies and internal disorganization as it relates to collecting and disseminating data. Again, coming up with supply chain management and how we can improve that. And one of the more interesting pain points that we've heard recently is how can we help support people that need to reach rural communities with very important resources. It's something that's come up given the recency of the situation. That's something that we definitely have helped with, as well as helping eliminate, maybe not completely, but very much so reducing how much manual processing of information you might need to be doing today. So by eliminating and automating that process, we can help you become more efficient in collecting your data. And then lastly, what you're looking at here is helping alleviate any research backlogs that you or your team might have. So, a question we would like to start answering in this discussion is, how does improved data allow healthcare organizations to address new challenges and send resources where they're desperately needed? And I'm going to go ahead and transition over to Crystal to talk about this and put more color into it.
Thanks, Paul. So to answer your question here, what we'll be doing is sharing an amazing use case for the CA Health Core program, where we use FormAssembly and Salesforce to address some of their business process and operational pain points. So for those of you who are not familiar with CA Health Core, this program was one of the many emergency responses to the COVID-19 pandemic for the state of California. It was spun up in April 2020 to address the surge staffing needs for medical facilities that were inundated with an influx of patients and where the staffing resources could not meet the demand of the patients who needed help. So Solem partnered with the California Department of Health and Human Services, California Department of Public Health, and the Emergency Medical Services Authority to provide a technology solution to manage and address the surge staffing needs for the state of California. So as you can imagine, and are all probably very familiar with in the healthcare world here, we had to act pretty quickly and figure out an innovative way to address this issue. From the program perspective, CEA Health Core was a solution to mobilize healthcare professionals to join the state government in a statewide effort to support the healthcare facilities. What I'll be focused on in our presentation today is how we use technology to address this need with both Salesforce and FormAssembly. The core of what we built in our Salesforce org is to, one, track the interest and eligibility of healthcare professionals who applied via a state application process to support the CE Health Core initiative. Two, respond to all of the surge staffing requests that were submitted from the county or from the medical facilities themselves by building out what we call deployments to track where the staff are needed. And three, we were able to fill those requests for the deployments by inviting participants who are interested in getting deployed to a specific region based on their geographical location. We're able to track which specific deployments they were interested in, what shifts they signed up for, when they are working, where they are working, and for how long. And the outcome of all of this allowed us to quickly and effectively deploy over 700 participants to serve at these facilities all over the state of California in the very early months of the pandemic. Now, so how does FormAssembly play a role in all of this? Well, what we did was we implemented FormAssembly and integrated it with Salesforce to gather real-time survey results from our participants. As noted in the first bullet point here, we sent out a survey using FormAssembly to ask participants of their availability and if they were willing to work at a COVID-19 treatment facility. Secondly, we were able to gather information about their preferences and the types of facilities they want to work at, what facilities they have experience working in, and if they were willing to travel a distance from their home county. And we got all of this data back in real time and fed it directly into our Salesforce system from FormAssembly automatically. And thirdly, due to the nature of the pandemic, preferences and availability changed pretty frequently. So with the quick, flexible, and secure benefits of FormAssembly, our deployment managers were able to get reliable and secure data in real time. This allowed our deployment managers to send messages with FormAssembly that are linked in these emails and send them en masse. They have dashboards with the data visualizing where they are at with these responses. And we also have what we call list views that capture a snapshot of what these responses are, so our deployment managers can easily act on it from within Salesforce. With this integration, there was no need to jump to different platforms. FormAssembly fed everything into Salesforce, so the user experience was seamless from within just one platform.
That's fantastic. Yeah, and then I'll add on to that, Crystal, and if something unexpected happens, FormAssembly is flexible enough to make changes quickly to any form because all you're using is the same link. Additionally, we offer a feature called Dynamic Pick List that allows you to populate multiple choice menus with Salesforce pick list values. And then you can also use live lookups to populate the choices in a drop-down menu as well.
Awesome. Thanks for that, Paul. There are definitely tons of different features in FormAssembly that we could take advantage of. And so for this particular case study, the one that I just described, we were able to address multiple pain points here. First, we were able to collect responses from these participants in a much faster and timely manner in the time of crisis. The forms and integration remove the ambiguity of data and responses since the information was collected directly from the source and then fed directly into Salesforce. So there was no need to manually track the response from an email and then have to enter it into the system. Instead, it was just done automatically. And finally, it created a format that was easy to adapt as the deployments and healthcare needs shifted throughout the pandemic. So on a related note regarding the flexibility of the different formats of the forms and the adaptability, here are a couple other use cases that we have extended the functionality of FormAssembly to address. So here on the right-hand side of the screen is a real example of one of our forms that we use to collect CDC training certification documents from our participants. This is something that we needed to do during the time of onboarding. And with FormAssembly, as you can see here in the form, we can ask participants if they've taken the training, and we can also have them upload proof of that completion. And through the integration, we were able to get responses and tie it back with a contact record in Salesforce, along with automatically attaching a proof of the completion as a file. So this also eliminated the manual work of checking hundreds of emails and downloading the PDF from the email and then uploading it to the relevant Salesforce record. Instead, this was also done automatically through an easily configurable connector for the integration. And secondly, now that it's been almost a year since we've launched the CE Health Core program, we're now reaching out to participants to see if they're still interested in participating in the program. This was especially important for participants who are less active and for the ones who are not engaging as much with signing up for shifts. And so what we would do is we would send them a form asking if they're interested in working with CE Health Core. And if the answer was no, we configured it to automatically update a status on their contact record to note that they are no longer interested, which in turn removed them from a list of people who would get contacted about future deployments. And by doing so, it helped maintain the integrity of our participant data from within our Salesforce org, and it was done so with very little effort. So all in all, this provided a very simple and inclusive way to check on the status of our participants for our programming. So that wraps up how we use Salesforce and FormAssembly to address some of the healthcare resource challenges for the state of California during the pandemic. So I hope that was helpful for you to see how we can use technology to solve some of the pain points for your organization. And on that note, I would turn it back over to you, Paul.
Yeah, thanks, Crystal, so much. And I just want to, echo this is such fantastic work, and I want to give kudos to Crystal and the Solem team for creating such, and providing and helping so many people, and having such a great streamlined process. This is just such a great, wonderful program. So kudos to you, Crystal, and the Solem team. So one of the questions that we've been getting in light of recent events is, how can integrated web forms help healthcare providers rise to the current vaccination challenge that we all have been hearing about? And so what I'd like to do is show you an example of a vaccine distribution form. So I've got these on this slide here, but what I'm actually going to do is I'm going to show you what this form is going to look like live and in production. So you should be seeing my screen now with the FormAssembly logo at the top. And what you're looking at here is an example form that we have and what it would look like in production for a COVID-19 self-screening test. All right, so you can see that we can quickly and easily collect basic information like contact details, but we can also populate an element on our form that allows your users to and respondents to select from a multiple choice drop-down list. You can populate this drop-down list by uploading a CSV, and it supports auto-suggest. So if you've got a lot of choices and somebody starts typing in the first couple of letters, it's going to narrow down those choices, so it makes the user experience very fluid and very easy to use. So that's one way that you can easily populate the drop-down menu choices. The other way that we can do it for anybody that's using Salesforce is by using the dynamic pick list feature that I was talking about earlier. So what you can do is you can pull the values from any Salesforce pick list and use those values to populate this menu. Or what we can do is we can do a lookup, and we can do a lookup to any object or record in Salesforce and return and use the values from that lookup to populate this drop-down menu. The advantage there being, if something changes in Salesforce, you are assured that next time your form is opened, that the correct choices that are either available or the most up-to-date choices are going to be what's displayed on your form. And then moving quickly through the risk evaluation portion of this form, you can see that we support different ways for you to ask all of these questions. Depending on how I select this, I can easily pass this data to a number of different applications, including Salesforce, which is what we've been talking about. And you can see here that hopefully they're not checking off every box, but we can collect information for any symptoms that they might be having quickly and accurately. So you can also verify that this information is correct here, so the respondent can check off and making sure that we have multiple ways to ensure that the data is accurate. And then once I hit submit, that form is going to be collected, and then the data is going to be passed through to however you wanted it to be set up. So wanted to show you a quick example of a live form. I'm going to go ahead and stop that now and then go back to the presentation. Again, what we were looking at here was the COVID self-screening template, but we also have an example of a vaccine inquiry templates as well. And happy to answer questions and provide examples as warranted. Okay, so now that we've looked at actual forms, here are some ways to implement them. So some of what we've been seeing people use is we can use our forms to track vaccination completions. We can create reliable forms for doing screenings. And then also what we can do is we can gather secure form file uploads. So any supporting documents that you might need, PDF, Excel, whatever supporting documents you might need, are you have the ability to collect those documents, and then you can attach that to any Salesforce record that you would like to support answers that you might be collecting on your forms. Additionally, we also support e-signature out of the box for Premier plans and up. So then that way you can have somebody approve or get an e-signature and sign off on whatever it is that they're submitting, and then collect both the information and the signature and any related metadata. Okay. Another way that you can implement web forms for vaccination is obviously to collect information about any inquiries or questions they might have about the vaccine. You can also, again, build and these secure vaccination forms really quickly and easily. So what I was showing you before with that live form, our builder is drag and drop, low code, no code, and it's really designed to be able to, for anybody at any organization, to spin up a web form very quickly, put some questions on it, and then get that data collected safely and securely. And then ultimately, as we've been talking about, we can connect that vaccination form data directly to the records in Salesforce, so it can become immediately actionable, and the information is disseminated in a great, really easy way. Okay, so from the operational side of things, healthcare organizations should plan to use data and form processes for the distribution of vaccines as part of a holistic supply chain management strategy. So really the net of what we're trying to say here is that the operational side, so the groups distributing the vaccines are also going to be able to benefit from the ability to receive this critical information quickly. Again, you can disseminate the critical information quickly and easily, improving both user experience for people receiving the vaccine and for all of the frontline workers. Thank you very much for all the frontline workers, for the people that are distributing the vaccine. Okay. And so looking ahead, both now and in the future, healthcare organizations have an immense responsibility to utilize high-tech solutions to both manage their patient data, which is what we've been seeing, and then also distribute these resources for maximum community and organizational impact. And really what we just want to share with you all is just planning for the future of healthcare mobilization begins now. And then this slide here is talking about how we have helped other healthcare organizations revitalize their data practices. So a few examples of who we work with are Aetna, QT Breast Health, Merck, and Continuum Clinical. And what we've helped them do is improve their data processes around just general information collection, any patient feedback and onboarding forms that they might need. Claim submission is another great one. We've been able to streamline any claim submission processes that these organizations have, as well as any requests through their website. You can embed our forms on websites as well as send out a link. And then that will also help with any application processes you might have around insurance, as well as collecting any health history questionnaires that you might be filling out, as well as scheduling vaccination. So again, just some examples and ideas for different ways that you can use different ways that you can improve your organization's policies for collecting data. And as a quick reminder, we offer plans that are HIPAA compliant as well. And so with that, we would like to thank everybody for connecting with us today. And hopefully, as Crystal had said earlier, we're providing some useful information. We are definitely happy to assist and answer any questions now. But here's some information about where we're going to be virtually. So we're going to be at our virtual booth until 4 p.m. Eastern. We're happy to make these resources available to everybody, but you can learn more at these links, request a demo. You can assist us directly. Then I'll pass it over to Crystal as well. Maybe if you can cover the Solem resources.
Yeah, absolutely. Thanks, Paul. And thank you all for joining and listening to our use case today. We really hope it was informative and shine some light to some of the options that we can use to leverage technology to support your goals and how we've used it to support our client goals. So if you have any questions about the process for how we did our solution, or if you're interested in learning more about how Solem can support your organization, please feel free to reach out. And you'll see that's my direct email address on that's listed there. And then the second link is a list to our different case studies that you can explore.
Love it. Thank you so much. Yeah, so thank you for attending the presentation. We're going to now take any audience questions that you might have for us. Fantastic. We did an awesome job, Crystal. Nobody has any questions.
Clear, very clear as day. No questions here.
Go ahead and give myself a pat on the back. But yeah, seriously, you guys did a great job. Is there activity tracking on the form? Thanks, Kevin. Is there activity tracking on the form? Can you elaborate on that?
Kevin, I might have a sense of what you're asking. So if I'm asking this correctly, let me know. But are you asking if on the FormAssembly form itself, is there a way to track when somebody responded and what the responses are and at time of submission? Okay, I got you, Kevin. So Paul, do you want to take that from a FormAssembly perspective?
Yeah, no, definitely. That's a great question. Yeah, thanks a lot so what happens is when you submit it, you're gonna, we can report on different metrics for all of the forms that you have with us. So you're going to be able to definitely tell when somebody submitted it, but you can also tell if there's been an incomplete response, if somebody started it. You can tell how fast it takes people to complete forms. Maybe that's a great signal for you to start evaluating what questions you're asking. Maybe they're a little bit more complex than you would like. You can also see completion rate as well.
Yeah, and I can add a little color to that from a connector perspective as it relates to Salesforce. So if we have their connectivity with FormAssembly and Salesforce and something failed where the response didn't come into Salesforce, there's also a way to track that as well. So we know when something has been undelivered, and then the admin can go in to release it or figure out what the issues are. So there's definitely lots of tracking from just the FormAssembly side as well as the Salesforce and FormAssembly integration perspective. Great question, Kevin.
Yeah, great question, Kevin. That's great. And I don't think you're a bad typer. I type in all caps as well. Thumbs up. That's great.
Any other questions?
Any other questions?
Okay, I don't see any. Oh, we have.
Yeah, no, that was. Yeah, perfect. All right, well, yeah, if there's no other questions, yeah, I think we're going to go ahead and wrap it up. Again, we'd love to see you at both of our virtual booths, and thank you. Oh, thanks for putting that slide up. Yeah. Thank you so much, and we hope everybody has a great day and stay safe, and thank you so much.
Thank you, everyone. Have a good day. Bye.
Bye.